Hi, Nursing 6113, Dr. Kim Paxton. This week we're going to be talking about health promotion in the family and how the family and the influences that surround the family can affect the individual and their health promotion and health prevention factors. Your objectives this week are to explore the different types of aspects that are involved with family health. You're going to start working to develop a health promotional plan specifically for an individual that takes into account those elements that affect the individual from a family perspective. You'll also look at structuring and begin thinking about, so how do you take care of the family as a whole when you have one person that you see in the clinic? And then we're going to have you begin appraising family health promotion interventions and evaluation methods in the clinical situation. So if you get a individual in and you start talking to them and asking them questions and you identify that the issue that's actually occurring from them is a family issue, how do you begin working with that? You have several different types of readings this week, specifically Chapter 7 from our Edelman book, and I'll go a little bit more in depth on some specific pieces I'd like you to look at in just a second. We also have a supplemental guide, a couple of them actually, in relationship to health promotion and prevention from the family perspective and children, but also from an ecological perspective, which is your last readings. Now, there are 3 different links here for you under the socio-ecological models, and each of them is a little bit different, but the takeaway you'll get from each of them is fairly similar. You're also going to see that there's a theoretical interplay that is occurring here, and I'm not going to tell you what it is, but I want you to be able to see it and relate back to previous work that you've done in relationship to change models and behavior, because you're going to see those embedded here. Going back into the readings in Edelman, Chapter 7 has a lot of absolutely fantastic information in it. And it's going to talk to you about family theories, but specifically there's going to be something presented to you about Gordon's functional health patterns. And this is really important for you to be able to understand, because as nurse practitioners, when we're talking to our patients and doing that review of systems and we do our social aspect assessment, we're looking for patterns, and those patterns help lead us into understanding processes, and then how can we intervene and provide intervention into those processes to hopefully help our patients. There's also, in this particular chapter, genomics, and genomics is a humongous up-and-coming science that we're really finding is very critical for us to be understanding. So when we're doing that family health history, that health history is really important for us to start looking at risks that our patient may be having occur that we need to address from the nurse practitioner perspective for health promotion and prevention. So for instance, let's say we find in my history that for 3 generations there's been an MI that has occurred under the age of 50. So you as the nurse practitioner, should you start thinking about monitoring my cholesterols earlier? Or should you have a stress echo to see if I actually are having changes occurring? So these are the type of elements that I'm talking about. Those patterns that I was talking about, these are located within Chapter 7, and they begin on page 153 under the titling of Health Perception, Health Patterning. And this is an amazing chapter. I know some of you may skim over the chapters a little bit, but I would really encourage you not to skim this particular part of this chapter, because this literally will help lay the foundation for giving you questions to ask your patients to gain understanding for elements that you could provide intervention with respect to them. I have them listed here. They are located in Chapter 7. And again, I really encourage you to take a look at these patternings, because they will help you develop those questions. Your learning activities this week, we have our discussion as we normally do. And your discussion will involve these particular questions. We're going to have you reflect upon a developmental perspective of a family. Now, not everybody in this course is an FNP. We have ANPs also. And you don't really deal with children, but you deal more with the adult. So is it going to be the younger adult? the middle-aged adult, or your geriatric adult. So take a look at those age brackets and then address it from that perspective. If you're in the FNP program, you can definitely look at that child lifespan and choose an element out of that. We also want you to be discussing something related to the socioeconomical framework, and we want you to really talk to each other about influences that can occur in other systems. So we have our family influence, we have the peer influence, the community influence, political influences, and in that political influence, I want you to think of the health insurances that are interplaying in, especially right now. If you're going to be looking at adolescence or the young adult, how does peer pressure overstep that of family in order for a person to be able to change or to want to change? And then there is an optional exercise for you to do to kind of check your thinking, and are you able to actually identify elements? This is that optional element. It is inside of Edelman. It is a case study. We do provide the answers for you, but it gives you a perspective from a cultural view of how to assess. So if you want to do this, you can. You don't have to. It is optional. You might find it fun to do. There's also an element within Chapter 7 that helps you understand a little bit more that diversity component. And it provides you with a really nice table that has you look at culture from a view that you may not have seen. So you may want to take a look at that table in Chapter 7 also. I hope you guys have a great week this week. If you have any questions, don't forget to be asking Scott and I them. We'll be happy to answer them for you. This last discussion is what I just talked about. Let us know if any of this doesn't make sense to you or if you get stuck on any of the questions. You guys have a great week.